everyone. Today we're gonna be tackling about sexually transmitted disease. We are have two objectives for today's topic. So first is to be able to identify the sexually transmitted diseases. Second, to be able to identify the different sexually transmitted diseases. So, what is sexually transmitted disease? So, STD or sexually transmitted disease are diseases that pass from one person to another person through their sexual contact. The infection can be passed on through vaginal intercourse, oral sex, and anal sex. So, some sexually transmitted infection can spread through the use of unsterilized drug, needles from mother to baby during childbirth, or breastfeeding and blood transfusion. Sexually transmitted infections have been around for thousands of years. The genital areas are generally moist and warm environments, ideal for growth of mucus, yeast, and viruses and bacteria. So, STD is critical public health concern because they can significantly affect the physical, emotional, and ethical social harm to individuals, communities, and society as a group. So, microorganisms that exist on the skin or mucous membranes or the male or female genital area can be transmitted as the organism in semen, vaginal secretions, or blood during sexual intercourse. As what I've said earlier, that STD can be passed on from one person to another through sexual intercourse.
Chondroid is a bacteria sexually transmitted infection characterized by painful sores. Chondroid is known to spread by individual to another. Chondroid is have been reported of accidental infection through the hand. The symptoms of chondroid is painful pulp in the skin of your genital. And also, the symptoms of chondroid is ulcer. Chlamydia is a common sexually transmitted that both men and women can affect. Chlamydia caused by bacterium called Chlamydia trachomatis. Chlamydia is easily treated with antibiotic. Chlamydia symptoms in women is change vaginal discharge, bleeding between menstruation period or after sex. Symptoms of chlamydia in men is burning when urinating, discharge from the penis, pain or discomfort in the test. Chlamydia can also infect the throat without symptoms. Infant or newborn baby to mother with chlamydia may experience eye infection or pneumonia. This can be treated with antibiotic medication for newborn. Crab pubicales. Crab pubicales is the insect that is an obligated ectoparasite of human, feeding exclusively by the blood. The crab pubicales is found the person pubic hair. Pubicales or crab pubicales is live in the armpit, chest, other facial hair, and eyelash or eyebrow.
Is the genital herpes. So the STD is caused by herpes simplex virus or the HSV. The virus affects the skin, cervix, genitals, and some other parts of the body. It is a long-term condition. A significant number of infected individuals never show any symptoms and do not know about their herpes status. Also, it is a significant sexually transmitted infection that requires attention due to its prevalence, potential complications, and impact on quality of life, as exemplified by some person that actually manage their sexual intercourse condition and maintain open communication to each other. So, as what I've said, sexually transmitted disease can be passed on from one person to another person through sexual intercourse, and it may affect the whole body as the bacteria comes around the body. So, next is the hepatitis B. So, it is a viral infection that attacks the liver of the person, and it can cause both acute and chronic diseases to a certain person. It is a public health concern due to its prevalence, potential for chronic infection, and transmission risk. Is HIV and AIDS. So HIV means human immunodeficiency virus, and AIDS means acquired immunodeficiency syndrome. So this is the virus that causes AIDS. Put simply, HIV is the virus while AIDS is the illness or disease. When a person has AIDS, their immune system is altered and they become more vulnerable to infections and disease. As the disease progresses, this susceptibility worsens.